Thank you very much. Today, I thought of addressing the subject of trade and health, which has been a continuing paradox in tobacco control in Zambia. We thought we should address this particular matter because of the repeated interruptions to the lawmaking process that we have had in Zambia since 2010, when the Tobacco Control Consortium started negotiating with the government to accelerate the pace at which they were moving towards tobacco control. The main problem that has been there has been the problem of the government prioritizing tobacco trade over the health of the Zambian people. And this argument is really fueled by the tobacco industry itself, which is full of exaggerations and full of falsehoods. To a large extent, the tobacco industry has put itself out as a major champion in contributing to the government treasury through the taxes that they are paying from dealing in tobacco trade, either it being tobacco leaf or being the cigarettes that they are manufacturing. But friends, you will know that really the tobacco industry is trading in a poison that causes destruction the world over. And in Zambia, we have our figures, and I hope we can get there pretty soon. The tobacco industry has come into Zambia and joined many other companies within the Comesa region, where we hear that, the tobacco trade is valued at approximately 1.5 billion US dollars. Yes, they are making so much money, but how much money of that is coming to the Zambian government? Just a little fraction. As I said, with a lot of exaggerations. In 2015, they reported that, they had contributed 4% of the Zambian GDP from tobacco trade. But actually, the real figure was 0.4%. What was surprising, of course, was that certain government departments quoted the 4%. And we find this as very unfortunate because we value what comes from our government, and we know that our government is supposed to bring to us evidence-based policymaking processes, and that they are supposed to actually get the truth, especially that there are so many of us who are into research. The tobacco industry, of course, has promised to come into Zambia and increase on their profits, meaning they are going to increase on the number of persons who are consuming their products. They are going to increase on the sales of their products. And we know that tobacco smoke affects not only those who are using the tobacco, but also those who are around the people who are using it. And what the tobacco industry never talks about is really the economic loss that is coming through their practices. The environmental degradation that is happening due to tobacco growing. The huge amounts of land which are being deforested, either for growing purposes or more so for treating the tobacco, especially for those who are growing Virginia. But we also have an amount of environmental pollution that has come in because of the cigarette butts which they are throwing away, or the foil within which they cover their cigarettes, and all that waste. It's bringing a huge burden on the Zambian public health system. All that is not taken into consideration. We just look at those small figures which they are paying in taxes, and we are saying that they are bringing in a lot of money into the Zambian economy. What is the actual narrative that the government is supposed to be leaning on? Really, the actual narrative must be that which comes from health. We have said health is wealth. It's not a fallacy. We know that health actually is wealth. And so if our government is going to make any sense out of their policies, we must have policies which talk to how much money we are losing by treating diseases that are being caused by tobacco, how much money we are losing by actually having our young men and women dying because of tobacco-related diseases. We know that in Zambia, tobacco use causes more than 7,400 deaths per year. And we know that most of these people who are dying are under 70 years of age. Young men and young women dying because of tobacco use. Most of them cutting their lives short by up to 20 years. Apart from those who die, those who live through their diseases spend a lot of time at clinics. Unproductive use of time. Actually, it is said that, tobacco causes a loss of up to 116,000 healthy life years. All those are losses which we should be talking about. In total, it is estimated that the Zambian government loses 2.8 billion kwacha per year, which is about 1.2% of our GDP. Now, you remember I said tobacco brings in about 0.4%, but we are losing 1.2%. 3 times more money is being lost because of people who use tobacco. It is time we talked about tobacco control seriously and using the lens that we have through our through health. Talking about tobacco control, we know that tobacco control is all about us laying on the table a range of supply, demand, and harm reduction strategies which are aimed at improving the health of the public, either by eliminating or reducing the consumption of tobacco or tobacco products, and also by reducing exposure to tobacco smoke for those who do not actually smoke themselves. The World Health Organization has proposed 6 value for money strategies that should be used by every well-meaning government to control tobacco devastation. And it is said that, if we did all these 6 interventions, which are core to this fight, we would actually avert expenditure of close to 685 million kwacha in 15 years. Direct benefit that would come out of doing this. We would actually save 11.8 billion kwacha in productivity losses. 11.8 billion kwacha would be saved through that, and would save 40,349 lives over the next 15 years. Everything put together, Zambia would be benefiting close to 12.4 billion kwacha over the next 15 years. This is a very good return on investment. We really think that, it is time the Zambian government invested in tobacco control, because it's going to bring us immeasurable benefits. It is time our government took the matter of tobacco control seriously, and also that they need to listen to those of us who have the figures for how much we are losing out of what is going on in the health sector. The economic narrative seems to have been so loud, because in March this year, our Minister of Information, talking at the T5 conference in Livingstone, really talked highly about Zambia's commitment to growing tobacco, and he was emphasizing the Zambian government's commitment to sustained tobacco production, even calling it our green gold, which was really emphasizing its purported contribution to the GDP and employment. Both false narratives. We really think that it is time the government moved towards us talking about health. We've said so much about how much money we would gain if we did tobacco control, because people's health would be better. But let me just give you a few more details of what exactly would happen if we are to do what I have said are the 6 core strategies that the World Health Organization has proposed should be done through the tobacco control law. It is said that we would actually be averting a total of 5,870 deaths per year, and would be gaining 93,000 healthy life years per year, and would actually have a number of strokes avoided. Okay, the figure that we have here, 4,336 strokes would be avoided just because we are doing tobacco control. And we also have close to 4,000 cases of heart attacks prevented because of tobacco control. All these put together make the health narrative stronger than the economic trade narrative that has been peddled through the years. It is high time we rose above ourselves to speak of what will benefit the nation most between trade in tobacco and the health of the Zambian people. We choose health, and we implore our policymakers to please choose health, that together we may have a healthy nation, because we have controlled the devastation of a major toxicant, a major poison, which is tobacco. Thank you very much.